Bring it on, bring it on. You, bring it on.
Life know the sweet though, hey. If some people know they hate you, so use the number 6 so and calculate, you go see the ratio. The beef self na me go, whether na asu them relate to. So bring
You are all welcome once again. For those of us that stepped in after we had welcomed members here present earlier, we'll go right into it as we invite pillars for a PCN approved MCPD training session 1 on the topic from local pharmacy data to global impact, transforming routine practice into real world experience. Pillars is a non-profit organization committed to advancing health research, capacity building, strengthening capacity, and fostering collaborative solutions that provide healthcare outcomes and inform evidence-based practice.
First and foremost, I want us to talk about the importance of your association. A lot of patients actually see community pharmacists more than physicians. I was discussing with somebody yesterday. Most people will have visited a community pharmacist. Out of 10 people, 5 or 6 will have visited a community pharmacy. Only the remaining 2 or 3 will go to the hospital, unless something happens before they get to the hospital. So that makes your work very important, because you are like the first point of contact with a lot of the patients or the people in the populace. And of course, the reasons are not far-fetched. Usually, we don't have too many healthcare workers in Nigeria again. And then most of the hospitals are short-staffed, so patients wait for a very long time. And Nigerians, we are always in a hurry. We are Russians, in quotes. We are always in a hurry, so everybody wants to go to the next place, get the medicine, and go back to work or go back to your business. And so, the value of community pharmacy is very key. And then consultation cost. Why do I have to pay 50,000 to consult when I can buy my drugs for 25,000? And so these are part of the things. And so what we see in the hospitals is not really a clear, how will I say, orientation of the real world thing. So we see more of real world evidence in community practice. And so that is why community pharmacy is very important. Next slide. So, what are the components of interaction between patients or clients? I know you prefer to use clients and the community pharmacy. So we interact. So we greet, and the client makes a presentation. And from there, you gather information. I'll give an example. Somebody comes in and says, oh, I've been having frequency of micturition in the past 3 or 4 days. And, okay, you ask a few questions. How many times a night? What's the volume? Is it large volume? Is it small volume? Is there pain? Are you diabetic? And you get all that information. These are very key clinical information that we need. And then you can advise and say, okay, I have a glucometer here, let's do your blood sugar. And then you do the blood sugar, and the blood sugar is 11.5 fasting. And then you say, oh, you have that. So these are very relevant data. Very relevant data. And then we go on and do intervention, and then give counseling, and patients goes. Patient may come for follow-up. And so during this process, we get a lot of information. So we can get information, of course, social demographics. You can get information about medication history. What have you used before? You can get information about potential drug-drug interactions and things like that. So we get a lot of information. Next slide. So, what are the kind of data we get from the pharmacy routinely? So, we get prescription records. And so, some may bring prescriptions, some may not. And so, we have that records. We get patients' names and demographics. And so I know most pharmacies now have some softwares that they use. So you can get patient's name, you can get age, you can get all that information. And that is very important. And sometimes the contact numbers. And so sometimes for the point of care, you get information about blood sugar, lipids, and we can do blood pressure and things like that. So we have all this information. And then sometimes the body weight. And then we can get medication history.
So this is going to be a practical session. So Prof has done all the background talks and everything concerning data. So we cannot live here if we don't do some practicals. Alright? Are we good? Yeah, so we want to do a real-time demonstration of an everyday pharmacy, the type of data we can get and what we can use it for. Okay, so I'll be speaking on data to actionable evidence. How do you transform your retool everyday pharmacy data into research, quality improvement, and better patient outcomes? So at the end of this session, you should be able to recognize what we call a valuable pharmacy data. It's not all data that are valuable, all right? How do you organize it? How do you even use it to identify medication-related problems? How do you generate evidence and then make practical recommendations and use it to convert into research output? I'm aware that many of us attend conferences. We go for international events, we speak there, but we'd like to also present some of these things there. And then funding is becoming very competitive. Alright? So when you have an international conference and you are submitting your work or your abstract, so what are the things that they are looking for? They want to see rich evidence. That is data. Next slide. So think about this. So let's have a brain teaser. So many of us collect pharmacy data every single day, but very little of it is even analyzed. By the end of this session, I hope you will be able to see differently. So I want to ask a very quick question. How many of us use softwares to collect data in our pharmacy? Do you? Okay, very good. How many of us still do the manual method? The manual recording method? No, don't worry, data is data. How? Okay, alright. So I want to now tell you that congratulations, you have a database. Whether you do it manually, whether you do it using a software. But there are some caveats. So data is not just the paperwork, but there's a powerful source for improving patient care and then evaluating the quality of your services, generating research, and influencing healthcare policy. My goal here, and the little time I'm going to spend with you, is to show you that you don't need a sophisticated research grant. No. To start producing meaningful evidence. The data you already collect is often enough to start. Alright? So we would share some results that we generated. Very descriptive things. We didn't want to make this session to be very complicated. We are not planning to turn you guys into data scientists, so don't worry. So the pharmacy that we are looking at is called Spring Pharmacy. That's the name. Sorry, if you're hearing that, I didn't know that. So we just coined it. So we want to ask some of these questions, and then we'll discuss. So if you look at table 1, from what you have in your hand, so who are the patients that are visiting this pharmacy? What are their age and sex distribution? Do you have more of anybody? Just looking at what you have in your hand. We are all scientists, so okay, children.
the female, 51%, that's 102 out of the 200.
Okay. So there are more of females.
Yes, more female.
What about the
age?
Yeah.
I think that would be the maximum, which is 85%.
Okay.
Be the age range that is attending the hospital.
What is the average age distribution of these people?
It is 51.9 plus
So
or minus.
they're in their early 50s, right?
Yes.
Okay. So
Early 50.
what does that tell you? Do you have any? What's
what is here? Just a minimum 18, maximum 90. The average age is 51. It means that those above 50 are the one attending the hospital most.
okay?
Together with the female.
So what does that tell you among? So if you have 200 people, and then we have that age category, are the ones that seek care in a typical pharmacy, what does it tell you about the younger population? Where are they? What do you think? Just random. Can we inquire more into why you have the younger population, not sitting there? Okay.
Because maybe they are not assessing the facility.
Okay.
As other people do.
All right.
I'll be introducing also the Pharmacy Intelligence Report, which is a proprietary platform we are designing to aid pharmacists to become very accountable to their data, to mobilize and deploy their data to work for them. Okay, so I'll just be running through some things that have been said. So we have a lot of data, yeah, but it's invisible. And these are the list of various ways in which we generate data in the pharmacy. So I think my colleagues have spoken a lot on this: consultations, prescriptions, vaccination, population health, whatever. And even when we conduct vital signs, we get laboratory report from our patient before we dispense drugs. All this does not just end at giving out the drugs. These are valuable data sources that we need to keep. Now, what should change? So we're talking about the transformation. What should change? Routine documentation and data aggregation. So putting this together in a structured way to allow it, one thing about building data is that you must have the use of the data in mind. It's by design, it's by default. You can't build a database, or you can't collect your data and then decide what to do with it after collecting it. So data aggregation is important to structure the data in such a way that retrieval, usage, whatever, deploying it is very, very easy. So then we talk about analyzing it. Once you analyze the data, you already have the insight, and those insights will drive better decisions and better patient care. Now, so this is just a summary of the gap. So I'll move on to tell you what we are introducing. It's called Community Pharmacy Intelligence Report. So we intend for this to be able to help community pharmacists see at a snapshot what is going on in their pharmacies. How do they improve? This will also be like, I want to say, a competitive edge in a robust assessment of pharmacies. Now, beyond sales volume and every other thing, we are also introducing metrics to allow you to say, oh, my pharmacy is doing better than the other pharmacies, or my pharmacy is doing better than the regional average, or the state average, or the global average, whatever. Okay, so this will include performance snapshots. You will see key indicators about the number of patients, what have you dispensed, what disease areas, how many ADRs have you reported, how many have you intervened, how many have you taken up the food chain and all that. So you can also see disease burden analysis, medication safety, strategic insight. Then also, just like I mentioned, network benchmarking. We can say, oh, in Abuja metropolis, my pharmacy is doing so much better in this aspect. Because before now, how can you make that comparison? It's almost difficult. So this is what we are introducing. So this is what it looks like, our pharmacy intelligence. So at a snapshot, you can see, oh, I've served this number of patients, this number of prescriptions I've dispensed, what is my documentation quality? So 96% of the patients that entered this pharmacy, I was able to record, or I was able to get all the relevant data that are necessary. And then we can also, through feedback, look at patient satisfaction. And we can produce, we can represent so many things. For example, you can see a bar chart here, and then it can come in different formats of representation. But at a snapshot, you can see, hypertension as a disease category is leading this month, or lisinopril or metformin is the most dispensed this month.
I don't know how many of us were in Yola. I don't know how many of us were in Yola sometime this year. And we had a brief of what we're going to do this morning in Yola. It was exceptional. It was awesome. And I had expected that this hall should be filled to capacity, because what is going to happen here now will certainly open more doors for pharmacy and pharmacists. I became a convert. I started studying fermentation, which is the historical way of creating something out of our fruits and vegetables, the old ways, sauerkraut. And if you come to my house, the way I show you that I'm a pharmacist is that I give you a fermented drink. I do a lot of zobo, but they are fermented zobo. This session will open your eyes to what is happening, or what is going to happen to healthcare. I am delighted to have Dr. Gia. And also, there's a junior Dr. Gia with us too. He came from the UK just to see his father speak again. Dr. Gia, let's have him. And then with us here are I suddenly call them the Dangotes of pharmacy, these young men here. Do you remember that word that says, let food be your medicines, and let your medicines be your food? In fact, yesterday I tried to see whether it was in the Bible and the Quran. I wanted a quote from the Bible and the Quran. The sage, long time ago, they told us that this is what was going to happen. Food must become our medicine, and our medicine will become food. The future of healthcare is in nutraceuticals. By 2023, not going to your papers, the value is about 3.2.7 billion, and it's projected to triple by 2030. So the point is, are we ready? Are we ready to share? And this could become just ours. The doctors want it, nutritionists are getting ready to take it, but I think we're most suited to grab this and run with it, without peeking into I know that Dr. Gia says he has a presentation. And then I think after the presentation, we're going to listen to the Dangotes, the pre-Dangotes of pharmacy, to see how they're getting ready. Not even getting ready, I'm sure you guys are already there. And how all of us, everybody must take advantage of what is coming in nutraceuticals.
As an introduction, nutraceuticals is the future of healthcare. A lot of things, a lot of diseases that hitherto were said to be untreatable, incurable, can be cured, reversed by nutraceuticals. If you remember what we're taught in physiology about hypertension, they tell you primary and secondary. Essential, non-essential. The essential of unknown origin, you just have to manage it. But with nutraceuticals now, we've now been able to understand that it is reversible and it is curable. Same thing for diabetes, type 2 diabetes, and a host of different diseases. Our bodies are completely structured in such a way that they can take care of themselves, cure diseases, especially non-communicable diseases, chronic diseases. But you must give the body what it needs. What we treat oftentimes are just symptoms, signs and symptoms. We do not go into the roots of the disease itself. And as pharmacists, this is a section, this is a place we need to hold tight. Like the chairman said now, the nutritionists are trying to grab this aspect. The medical doctors are into it, fighting to make sure you get it. The nurses are equally doing that. But we are most and best suited to handle nutraceuticals. The word nutraceuticals came from two words: nutrition and pharmaceuticals. Nutrition and pharmaceuticals. If nutrition were to have been added to our course in university, the course of pharmacy, in 10 years, we will not run the pharmacy. And that was why they just let it at bay. Nutrition, these particular nutraceuticals are not taught to doctors. Doctors don't believe in it, but they are beginning to come up now. Pharmacists, we need to rise to the challenge and take up nutraceuticals. Now our body is essentially structured. We need about 92 essential nutraceuticals. The B vitamins, from thiamine, the minerals, the amino acids, and different others. Whenever they come and start telling you that we are not nutritionists, that is totally wrong. We are pharmacists. And part of nutraceuticals are herbals. And that is why we're taught pharmacognosy in school. If you take green tea now, green tea contains EGCG, epicalocatechin-gallate, a powerful antioxidant that has been used right away to even distort the metabolic pathway of cancer cells. Cancer cells, EGCG, very powerful antioxidant, used in the immune system, is a herbal tea. So, fatty acids, omega-3 fatty acids, omega-6, omega-9, powerful antioxidants. You have probiotics and prebiotics. You equally have postbiotics from fermented food, like the chairman said now. Sauerkraut, kimchi, kombucha, kefir, and so on. Because these fermented foods are able to generate what we call probiotics and postbiotics. I'll give you an example. Nattokinase, an external fragnolytic enzyme. They use salt to ferment it. And what they do? They add Bacillus subtilis natto. And once you add it to ferment the soil, what does it give you? It gives you an enzyme, nattokinase. That is a particular enzyme they use now to dissolve plaque, arterial plaque. Arterial plaque. Plaque in the arteries. It dissolves it. So it's a huge area and it's an interesting area that's coming up. Now you have the vitamins, the V vitamins and the fat-soluble vitamins, ADEK, A-D-E-K. Vitamin K2 is equally used to dissolve arterial plaques. Vitamin K2. So whenever you are taking vitamin D, ensure you equally take K2 along. Otherwise, vitamin D will ensure the absorption of calcium. And where does the calcium go to? Keep wondering. Kidney stones, bladder stones, goes into the arteries to harden it. But K2 mobilizes the calcium and takes them into the bones and teeth. And that's why you see when people begin to age, they shrink, and the structure, they begin to bend using walking stick. Because the calcium is not in the bones and teeth. Now you have amino acids and proteins.
Thomas Edison, he said that the doctor of the future will no longer be treating the human frame with drugs, but rather will treat and prevent diseases with nutrition. Do you agree? If you agree, what are your perspectives as somebody who is you are not a manufacturer, but who has been with us in supplying some of these nutraceuticals? What do you think?
Good morning. Before I say anything, I really want to appreciate the fact that I'm sitting with the giants in our nutraceutical space and Dr. Jia too. And so it's a privilege to be here, and honestly speaking, I don't take it for granted. It's not every day a small boy sits with the people he looks up to. So please, I'm really grateful for that. Thank you so much. One of the reasons I am very passionate about nutraceuticals is because I feel even the idea of nutraceuticals being the future, I'm not comfortable with it. I know that it's not the future, it's now. It's happening. There's a video I made the last time I was in Istanbul. I walked into, it looked like, from the outside, it looked like a candy shop where they can just dispense different types of candy. But to my greatest surprise, it was a herbal shop. I wish CEO could play it. It was a herbal shop, full functional herbal shop. All they give out in that shop, different types of, if I bought some, they have system where they dry different forms of herb. You gave me the one I could use to sleep, different combinations of different types of herb. You would think it's an ice cream shop, maybe a dry candy or something. It wasn't. Before then, I've always imagined why are we not taking nutraceuticals as mainstream? That has always been my drive. Why are we looking as if it has to be something that you use to support? And if you take this one, you cannot add. No! The future has long gone past taking nutraceuticals as a support. I know our regulatory bodies want us to keep it, yes, it's support, label it support. We're doing that, but all of us know that I'm one of the most grateful person that Dr. Jia talked about the advancement in the formulations. Honestly speaking, everything he talked about, 90% of all the products we formulated in Hoshi, every single active, that's how we have different interactions. Why are we not? Why using folic acid? Why 2026 we are still giving out folic acid? Why are you still giving ascorbic acid? There's no reason why you should be giving your patient plain ascorbic acid. The world has long gone past most of, and that's why we are not getting the result we are supposed to get from nutraceuticals. That's why we still act as though they are supporting. No, my position has always been from day one that nutraceuticals should be mainstay, should be mainstream. The way you can have your pharmacy and open another branch as a nutraceutical pharmacy. Do you understand what I'm saying? It shouldn't, nobody says it must always be in your conventional pharmacy. Nobody says you can even have the raw herb. Sorry, I'm taking. Nobody says you can't even have the herb dispensing them. We are pharmacy, that is from our primary duty. Medicine started from herbs. Every other thing is built on it. So the world is going back to where it came from. And I think we are the first and most important people to play in that space. Thank you so much.
Thank you. You can see how passionate he is. Carrot Top. My thought was that you saw the future. top. I was going to ask sometime, why carrot top? So how do you perceive or you perceive what was coming and you named your business Carrot Top? Are we ready at Carrot Top for what is coming?
Okay, so let me start by answering the side question you asked, why Carrot Top? I don't know if you ever noticed the top of carrot never dies. Have you noticed? The top of carrot never dies. It remains evergreen. Hence Carrot Top evergreen brand. So now you know, sir. Yes, I agree absolutely that the nutraceuticals is not the future, it's actually now. And like the list that I pointed out, it goes just beyond the herbs to the minerals, the trace elements body needs to have at the right quantity. Now I like to use two specific examples in my area of specialty to bring it down to your practice level. Of course, my specialty, fertility and wellness. So let me start with fertility. You have a client who walks in and she comes in with a prescription for pregnancy test, baby woman, and then you dispense that to the client. You should be aware that pregnancy test contains the endometrium. One, then secondly, it also called arthritis. Now, these are inimical to the desired outcome. The desired outcome is for the patient or for the client to be able to have ovulation induced and ultimately achieve pregnancy. But these adverse effects I just mentioned now would make that difficult to achieve. Because if the endometrium is stained, even if conception is achieved, you may have miscarriage. So now you can intervene by ensuring that clients who comes to your premises to get any brand of pregnancy threats, I like to call my brand of mean, you add L-arginine to that prescription, or any product that has L-arginine in it to that prescription. Why? L-arginine, you know, is the biological precursor of nitric oxide. Okay, nitric oxide at the ovulatory phase. So I was saying that nitric oxide will also increase the endocervical secretions at the ovulatory stage. That will take care of that adverse effect of causing vaginal dryness, which ordinarily would make it difficult for the sperm to be able to swim to its destination. In fact, if you know the distance the sperm swims from the cervix to the uterus where fertilization takes place, it's like a woman swimming like 5 kilometers. So it needs all the barriers in this part removed. So that's one. Then two, you can add vitamin C to, you also give that client vitamin C. Why do you give vitamin C? Vitamin C actually, let me give that from what I wrote here so that I can quote it correctly. Studies have actually shown that vitamin C supplementation will cause significant increase in endometrial thickening. So the first side effect I talked about, which is the thinning of the endometrium, you can counter with vitamin C. So that will ensure that if conception, if there's a successful conception, there will not be miscarriage. Now, why is vitamin C able to do this? Vitamin C is able to do this because it's a cofactor in the synthesis of collagen. Now, they may look simple, they may look ordinary, but these are interventions that can make all the difference. And that's why personally for us, we'll always recommend that when you have a client who is on prevention citrate, we recommend you give the person our evergreen CM, which has the components I just mentioned and the others. Now, let me mention on the area of wellness. I know most of us know indapamide, and otherwise excellent antihypertensive, particularly for the blacks. Okay, but there's a small drawback with indapamide. Indapamide causes what we call hypokalemia, low potassium. I had a parishioner who complained that even when she wakes up in the morning, she's feeling as tired as the day is already spent. I mean, she feels fatigued and all that. She was or she is on indapamide. And what did I do? I gave her our Helen Hattie for women 50 plus that has potassium 80 milligram, and that's all she needed. Now he's mentioned an array of vitamins that the body needs to function optimally. I'm sure that if we ask around, most of us are not taking any vitamin at all. By the way, the lady, I could have asked her to take lots of plantain to get the same calcium, but of course that would not be very convenient. And I think it makes more economic sense for me to ask her to take my Hela Hattie Women 50 plus. Or don't you think so? Very much so. So if we take a sample in the hall now, we find that most of us are not personally on any multivitamin, and that can actually be very detrimental to our health, because the truth is, even though yes, most of these are things we can get from the food we eat, the reality is that we don't ever get enough. And that's why those vitamins have been, those multivitamins have been formulated knowing with in mind all the things they require, the daily value of what you require to ensure that organs and the systems work optimally. So let me stop thus far.
Nature field, we're coming to you, and the thoughts are, where are we with you in this our plan to ensure that by the time we meet next year, we have about 50 pharmacists who are setting up independent nutraceutical, do I call them pharmacies? Or let's, for want of words, attachments to the main pharmacies. And that if it's possible, we're even going to be doing herbs, local and wherever we can get them, with a well-cooled shield. What are your plans for us at Silken?
I want to start from one of the resolutions that we made here today in terms of having a masterclass for the next 2 years where we have financial literacy and nutraceutical training. As a clinical pharmacist, we are actually meant to drive both the business and the clinical value. And I've seen from our experience that most of us pharmacists, even seated here, we're actually not trained on supplement while we're in school. It's a big gap. No doctor was trained on nutraceutical or supplement. And I still believe till now, some of us, even in our practices, when we happen to even recommend or dispense this nutraceutical product or supplement, we recommend it as if we are dispensing the common therapeutic product. Take for example, there's what we call supplement fat with respect to nutraceuticals, and in terms of their dosing and dosage is different from what is obtainable with the conventional medicines. So you see 4 tablets, maybe it's vitamin, let me just say, let me use sulfametol, 990 milligram, 4 tablets to be taken. You will believe that it's each tablet or each capsule that is 990 milligram, thinking the patient should be taking overdose, not knowing that in the use of supplement or nutraceutical, there's what we call serving size. There's what we call daily serving size. And if care is not taken, because you don't want to give the person 2 capsules or 3 capsules, you tend to underdose. So there is still a lot of knowledge gap, which we have also identified. So like the question the chairman asked, what we have started to do in nature's field, number one, is to beyond, right now we have over more than 86 nutraceuticals supplements in Nigeria. I will keep expanding because like you say, the nutraceutical is not the future. So what we have started to do is, we have tried to identify with some universities, catching them young, especially during their induction phases, educating them in terms of what? The benefit and the importance of nutraceutical and supplement. And secondly, like the question you ask, which is also what I also pick from my other colleague here, is having a session of nutraceutical, and which is actually what we have actually started with some of our key partners, having even in the outlets, having all nature's food product ranges, like the video we shared at the opening ceremony. Our plan is from preconception to advanced stage, that nature's food products, is able to provide well-called solution. So the solution will not be able to provide is if the person is dead and buried. So what we are actually doing with our key partners is to ensure that in their pharmacy, we have a session that is dedicated to the nutraceutical, and beyond that, to also support capacity building.
Very interesting panel. I want to welcome you to yet another important panel. Politics, policy, and community pharmacy. Strategic engagement for universal health coverage. But let me begin with a simple question. Who really determines whether a patient receives quality pharmaceutical care? Is it the pharmacist? The medicine? Or the policies that determine whether those medicines are available, affordable, and accessible? The reality is that long before a patient walks into a community pharmacy, policy has already shaped most of their healthcare journey. And policy is shaped by people who choose to engage. Community pharmacists are among the most accessible healthcare professionals, yet our influence on the health policy often falls short of our contribution to patient care. If we are absent from the rooms where decisions are made, we cannot be surprised when those decisions fail to reflect our values. So today, I invite all of us to reflect. Are we shaping health policy or simply responding to it? Can Nigeria truly achieve universal health coverage without fully integrating community pharmacists into primary health care? This conversation is not about partisan politics. It's about leadership, advocacy, influence, and ensuring that the voice of community pharmacists is heard wherever it matters the most. I look forward to a honest, robust, and solution-focused discussion. So ladies and gentlemen, let us begin.
Everything about politics continues to shape the totality of our lives and endeavors. That's why I said this is a very strategic and fundamental session. And if I ask this crossview of participants what they think politics is, I'm sure there will be more than 1 million or 1,000. There will be more than 1,000 different definitions, and that's the same thing political scientists have done. But for me, as Olumide Akintayo, the most acceptable definition of politics for me remains that which describes politics as a science of governance. Politics is best described for me as a science of governance. Why? Why do you think it is a science? The science because it must be right mix attitudes, emotions, to continue to plot, scheme, navigate every dot or iota of human endurance. And that's why sometimes politicians are seen to be different or perceived as totally different from true leaders. If you look at leadership, it's completely different from politics. And that's why we experience some of the woes we have in our country. Leadership is best described as the humanity of governance. Politics, science of governance. Leadership, humanity of governance. Humanity, because at the heart of every leadership, I will be impactful, excellence. You must have the qualities and virtues, kindness, patience, empathy. These are the things that are lacking. That is why in the third world, being the third world, leader is not bothered about anybody. If he wants an election and every other citizen perishes, it's not his business. As long as he has power. And that's the perfect example of the politician. A leader, on the other hand, is more compassionate. That is why even when we assume that some territories are led by people who don't know God, you see that we continue to excel in some of those territories. Leadership is concerned about giving them education so that human development index continues to soar in such places. That is why they say in the Holy Book, for those of us who profess Christianity, you know that book says righteousness exalted a nation. But that righteousness is nothing, that righteousness has nothing to do with being holy. It's just about a certain level of do-goodness. You're doing the right thing. Give the people education. Give them policies that promote access to good health and all of that. Now, I have decided to give you this background that we know what we are here for this afternoon. And I expect that at the end of this, questions and all that. In community pharmacy and by direct extension, pharmacy, why does it appear that we are not making progress? The simple truth is, we're making progress, but it's not the quality. It's not as fast as we want to see it. Every time it appears there is a gain, there is an existential adversary who quenches the momentum of that gain, the fire, the good spirit it brings, it embellishes. Why is it always like that? The truth is, for some strange reasons, we have decided not to be in the bedroom of politics, in the master room. You know, in the past, they used to talk about people being in the corridors of power. Today, in my experience, we have gone beyond corridors of power. It's, in fact, not just any other bedroom. It's the master room. You must have access to that master room. And I give you some statistics on why it appears some of our grassroots continue to have a upper hand. In the Federal Executive Council, today, you have 7 physicians. You have 8 lawyers. In the federal bureaucracy, there are about 40 permanent secretaries. 17 of those permanent secretaries are physicians. 15 core physicians, 1 dentist, 1 optometrist. So clearly, at least 15 out of 40 belong to one block. And that's why, in terms of policies and all of those things, so it has gone beyond writing good memos. We have produced some of the very best memos on the platform of ACPN and PSA.
Let's start by recognizing the fact that as a profession, we are at a critical moment. And when we talk about universal health coverage, it's been signed. And I always tell people that whatever has been signed until it is repealed is a drive that, if not pursued by this administration, will be pursued by another administration. So we know that as a country, we have signed to achieving UHC by 2030. And we can see that certain things are being put in place. One is the new NHI Act 2022, which has made health insurance mandatory for everybody. We know that coverage right now is around less than 15% and is majorly focused around the formal sector. And then there's also the financing factor. It's the fact that the government has put money in the basic healthcare provision fund, particularly to fund medicines, essential medicines at the primary healthcare level for the poor and vulnerable. And the entire business of Medipool, I don't know if we've been engaged with Medipool, but that PMG man is actively engaged in Medipool. It's actually tailored around the funds that is coming from the DHCP funds. The other thing I'd like you to recognize is that in spite of all of this, the acts, the targets, and of course, the funds or the money, the drugs that are being procured, there's still a gap. And that gap is a gap that remains. The fact that enrollment is low, schemes are fragmented across different lines, and delivery capacity based on the target, I can say, is an ambition. So, what can fill that gap? And that's the area from which I want to steer this conversation. I don't want to come here and talk about professional rivalry. I don't also want to come here and talk about how the government is not treating us right. But who can actually fill this gap? Next slide. One of the things that is clear about who can fill this gap is that they are all seated in this hall. They are everywhere. Thousands of registered or some unregistered community pharmacists inside every neighborhood. I hope we recognize the fact that community pharmacy is the closest primary healthcare center to the individual. But yet, we are not recognized as a primary healthcare center for society. So those are the conversations. We are open for access to patients. So it therefore means that if you are talking about the demand side and the finance side, we play a critical role. Trusted. And I say low first-time contact. Now, while we talk about all of this advantage, and we are so happy to pride ourselves that that is who we are, let me also remind us that our work contributes to what we call economic impact. You know, I try to just do an average, what I call a desktop review. You will recognize the fact that community pharmacists employ thousands of persons. And that's a conversation of numbers that we're not bringing to the table. The conversation again that we're not bringing to the table is how we are contributing to human resource for health. We are in a situation where, I don't know how many of us, I listened to the last platform and somebody talked about money points and how difficult it is to get persons. The honest truth is that we are actually in that big challenge. I like to say this before I move forward. When the chair of the last panel asked for how many young pharmacists were in the hall, there were very, very few. I think most of us did not sit back to ask ourselves why. Public opinion still see pharmacy as a high-value profession, and it's something we must capitalize on. But the practitioners themselves, particularly the young ones, they don't see that. And that's the reason why they are not here. It is a ticket for them to japa, because as a pharmacist, your pathway is faster than if you are not a pharmacist. And so they won't be here because the conversations is not steered in the direction that they want to go. So we must begin to itemize our contributions to human resource for health and how we continuously reduce what I call the unemployment rate.
Okay, Pharmacist German to you. Drawing from your experience with diverse pharmacy-related grants and programs, what have been the most effective model for engaging community pharmacies in universal healthcare?
Good afternoon, senior colleagues and colleagues in the room. Thank you, Dennis, for speaking my mind. And I'm sure it's because we're in the trenches together, so you also understand the issues. And with my experience, really, implementing at the level of implementation, because there are different levels where pharmacists can actually get involved. And thank you to the past president for also mentioning the politics that goes on in the room. At the level of implementation, what works majorly is sustainability. If we talk about everything, the politicking, all the other ingredients that go into the cooking, without sustainability, we won't be here. And another thing is also scalability. So scalability and sustainability are really very key. And one thing that has come out in engaging community pharmacists in projects and programs is the understanding that community pharmacists are largely for profit. And so because community pharmacists are largely for profit, there's no program that would really come to community pharmacists and say, provide this service for free. There's always fee for service. And trust me, the people that you think wouldn't pay are willing to pay for a whole lot of reasons. And I'll use myself as an example. I'm not ready to go stand or wake up at 4 a.m. to queue at a hospital if I can get the same service at a community pharmacy in, say, 20 minutes. I wouldn't mind paying for that. And there are quite a number of people who are willing to pay for that service because time is money. Another thing that I would say is really very key is linkages. As community pharmacists implement linkages to government structures is also very important because that is what is sustainable. Even when those programs and those projects exit, linkages to government structures are very important. And one example is the differentiated care in HIV. And we can see how that has outlived even the projects that started that strategy or whatever in implementation. So this is also one of the ways that community pharmacies strategies that have worked in engaging the community pharmacies. And expansion of services. My colleague mentioned the task shifting and task sharing policy. And I'm sure we've talked about that so much. And thankfully, the PSN Foundation, which I work with and I'm a program manager at, has really worked extensively with the task shifting, task sharing policy. And that is one policy. That policy is like a silver bullet. It is one policy that has opened up the conversation, that has opened up the space for pharmacists. Almost all the conversations that we've had around what community pharmacists can do, I don't want to go into all the other aspects because the lead speaker had already laid that foundation about how community pharmacists are positioned in the community and a whole lot of other aspects. But that is one policy that has really changed the landscape. As we speak, the policy is currently being revised, and a whole lot of other aspects are coming in. NCDs, emergency response. We saw what happened with COVID, how people ran away from the more clinical settings, the facilities, and went to community pharmacists to be able to access basic healthcare service. And so these are pillars and strategies that have worked over time. And I dare say that public health, it is important that community pharmacists begin to change the way they work and the way they serve the communities and the way let me just say, behavior and begin to widen their scope.
Now let's go to the politician in the house, Rebulena Okuma. From the state executive's perspective, please can you have the microphone? What concrete policies, maybe if it's budget, if it's sector reform, if it's PPP, that everybody in the state is always about, may be deployed next 1 to 2 years, such that community pharmacists will be partly integrated into universal care programs. Do you have in the state executive can do or is doing for the next 2 years?
Good afternoon, distinguished colleagues. Good afternoon, Prof. Thank you for that very important, timely question. From the executive perspective and in my capacity as a senior special assistant to the governor of Adamawa State on pharmaceutical matters, you will agree with me that the main objectives or goals of universal health coverage is to ensure that every citizen participates and gets adequate medical care, health care services adequately. And believe me, in my opinion, that this cannot be achieved from the state government if they focus just in building or expanding facilities. Now, we can strategically use the opportunity by using the inbuilt or the outstanding health professionals that is on the ground to utilize and achieve that goal. All the qualified here. We don't need to build new systems. We need to use the existing ones because that would save cost and that would also make us reach maximum goal. You will agree with me also that community pharmacies are one of the most underutilized assets the government have. And the normal, the regular individual on the streets sees community pharmacy as a place he can just walk in, buy some medication, make payments for the services you have rendered, or rather, give you a prescription, you refill, and he walks in, make payment and walks away. There are a lot of gaps. The ordinary man on the street doesn't know that we render clinical services. They don't know that we can do more than just giving you that paracetamol you requested for and walking away. They just feel that that is our role as pharmacists. Now please tell me, community pharmacists, who is going to do this for us? We have to take the lead. We have to create sensitization to the community where we find ourselves by improving our role, by changing the narratives, by making them understand that most of these services, healthcare services, prevention healthcare services can be gotten from community pharmacies. We talk about high blood pressure, hypertension, diabetes screening. These are services that we can give. Maternal child care counseling, drug medication advices. We can give them freely in our pharmacies. We are the people to do that. Nobody will do that for us. Who is going to tell them if we don't? So trying to sort this out, you would agree with me that we have a lot of work to do. There are the gaps that we must fill for us to be able to change that narrative that we just come into the pharmacy and buy this medication and leave. Now, in the next 12 to 24 months, I have 5 solid, concrete policy levers that can help integrate community pharmacists into the present primary health care agency and making relevance, changing that narratives on the platform we are. permit me to go through this so that I can just give it to you the way it is.
Yes, you can list them. List them.
Yes, let me just list them. First is the institutional dedicated budgetary provision. Now the state government have to make provisions for funds to be able to sponsor these activities we're talking about in the community pharmacy. Now for creating opportunities for community pharmacies to be able to render health services, prevention health services like checking of BP, diabetic screening, and the rest of them. Secondly, we have implementation, regulatory and policy reforms. Just like our Jagabad spoke earlier, if we are not at the corridor of power, please, how are we going to change these policies? Who is going to speak for you? I put it to you. If we are discussing, you have conversations with friends, relations, and you see that everybody is bringing in what he or she wants to the table. So if we are not at the corridor of power, who is going to speak for us? Nobody. They don't care about us.
I want to quickly dive right into it because we know that we've been here for a bit today. Our panel topic is financing sustainable growth for resilient pharmacies and healthcare businesses. I want to start by mentioning something. The previous plenary session that happened was on policy, politics, advocacy, regulations, all of that bit. And it just points to the peculiarity of the industry and the business of healthcare. I think one thing that is also standing out is funding, financing, and growth. How do you scale healthcare businesses in Nigeria? How do you scale them into global healthcare businesses? And what is required to do that? I am going to go right into my first question. And just as a brief introduction of Dr. Christopher Heyman of Net Pharmacy, he has built and scaled a pharmacy business in this exact Nigerian economy. And he kind of brings the operator's view on how you actually fund and manage a healthcare business on a day-to-day. So, Dr. Chris, good afternoon. My first question to you would be, many pharmacies and healthcare businesses, are very profitable on paper, but they still struggle with cash flow. In your own experience and looking through your journey with Net Pharmacy, what is a financial habit or a business decision that you've made that has made a big difference in your long-term operation of your pharmacy?
First of all, I want to thank Vivo. I think formerly Nucleus IS. Okay. I also want to thank other people in your space, the fintechs and all those who are providing quick loans to a lot of community pharmacies. But for people like this, I'm sure a lot of us will have faced a lot of financial struggle. So I want to thank you on behalf of everybody present for providing the finances that help us to improve business and scale our business. If we were to depend on the traditional banks, I'm sure a lot of us would have suffered a lot. So thank you very much. Now back to the question. The question is talking about those financial habits I've learned over this period that help us to have a sustainable business. And the fact that, yes, your community pharmacy may be profitable, but you still struggle financially. Okay. What I've learned over the years is that, yes, you make profits, but profits is an opinion, it's an accounting record. It's at the end of the day, when your internal or external auditors come and audit your book, they say, okay, this is the profits. But what is most important for a business, a community pharmacy, most importantly, is your working capital, is your cash flow. Cash flow is the lifeblood of any retail business. cash flow, without cash flow, your business is not likely to survive. Yes, you may be making profits, but if you don't have the cash flow, you are likely to struggle a lot. Over the years, I run a chain of pharmacy. At the end of the period, they say, okay, you made profits, but we struggle. I'm sure a lot of us are in that space. We struggle to pay our suppliers. You know why? Because that cash you think you have is locked up in inventory. You don't have it. You just don't have it. So what we've seen is that yes, you might be profitable at the end of the day when there's an accounting is done, but you don't have the cash to run business. And so what is important for us as community pharmacists is that we must know how to manage our cash flow, how to manage our working capital. Managing working capital or cash flow involves a lot of things. I'm sure over this period you may hear people have talked about how you convert inventory into cash, your cash conversion cycle, how you manage your suppliers' credits, how you manage your inventory, how you manage suppliers' credits. The important thing for any retail business is how quick can I convert my inventory to cash. Whether you make profit or not will come at the end of the period, maybe a quarter, a year. But if you don't have cash right now, your business cannot survive. Let me give you an experience. I have a lot of friends who play in the grocery business. Okay. Big box grocery business. Now I have this friend who had a very big grocery chain. He sells all kinds of things. And one day we were discussing, and he told me every time I struggle to pay my suppliers, if I take valuation of my inventory, run into billions, but I don't have the cash to pay my suppliers. Then he had another friend who is into restaurant business. And that one for him, when you say you don't have cash, you look at you as if you don't know what you're talking about, because he's liquid, he has the cash. And he now said, okay, let me do something. Instead of using the whole of my store for groceries, where anytime I come in the morning, I just look at the whole stock. My money, cash is there, but I don't have the physical cash. Let me see if I can use part of this my store for restaurant business. So he started. In the restaurant business, they will buy maybe a sack of rice, a sack of beans, or whatever in the morning, convert it to food. In the evening, everything is sold, and he's getting all this cash. You understand that? He's getting all this cash. Now, what he's doing now is dividing his stores into equal half. One part for the grocery, one part for the restaurant, because he discovered that the restaurant is bringing in more cash than his grocery business. So what we are basically saying here is, one of the things I've learned over this period is that profit is important, but cash flow is more important than your profits.
From your point of view, when it comes to raising money, getting funding and financing, and how it brings more, scope for expansion of businesses, my question really is, in the healthcare company that you've built and that you currently operate, what financial decisions which you're raising has given you the large scale, and how did you make it work?
Okay, thank you very much, and thank you, Rigo, for inviting me to be part of this very important discussion. Ladies and gentlemen, good afternoon. I'm a doctor, a medical doctor. So you can imagine how uncomfortable it felt to be in this atmosphere where you're talking now, my colleagues. But on a more serious note, I dream of a future where we can actually really work collaboratively together. And instead of, finding this professional rivalry between doctors and nurses, between doctors and pharmacists, between doctors and other healthcare professionals, and this is not blaming anybody because it's the same on the other side. I really dream of a future where we can really come together collaboratively for the sake of our common mission, which is the patient. There is no single healthcare professional or professional group that can solve healthcare problems on their own. We all bring different expertise, professionalism. And as I sat down there I was talking to my brother and I said, are we saying that as educated, as experienced as we are, we can't really come together as professionals and table all these differences on the table and reach an amicable resolution? In the UK, they're now leveraging pharmacies to provide clinical care. Nigeria does not have enough doctors. So there is no way any single profession is going to be able to work alone. And I think that we need to start talking from that perspective. And this applies to nurses, doctors, not just pharmacists. So please, we need to think more collaboratively, because the future of healthcare is going to be driven by technology, collaboration, and it has to be patient-centered. I just thought I'd drop this line. Thank you. So I'm leading a multi-million-dollar digital health transformation across Africa called Mobi Health, supported by Afrexim Bank. And I'll say that there's been a lot of misconception around funding, financing. Most people believe that you need money, you need to raise to be successful, to grow, to scale. That is partly true, but we've seen quite a number of organizations raise a lot of capital and they busted. So I think it's about disciplined financial management, disciplined financial execution and allocation that helps us to scale. I've been listening here all day and I hardly heard anything much spoken about leveraging digital health to scale your pharmacy business. Pharmacies are going to be central to the next level of healthcare delivery globally, and we are seeing it play out. You're the quickest access to doctors. You're the quickest access to healthcare in a community. 80% of Nigerians come first to the pharmacies before they think about going to the hospital.
Apparently, in your years of working in healthcare financing, what are signs, and this is big masterclass, what are the signs you will see from a pharmacist book and feel that in the next 2 years you probably struggle, or what are signs that you see of like, you know what, you are ripe for funding and we can fund your business?
Rigo Microfinance Bank is an healthcare bank built for healthcare businesses strictly. So which means that our focus and our goal is to empower healthcare businesses to scale, and by providing financial solutions that does not only improve your working capital but also improves efficiency and lead to scale. So over the years, having partnered with over 2,000 healthcare businesses, one thing we've noticed is that successful pharmacies are really the biggest pharmacies. They are actually the most disciplined. So, you know, a lot of people confuse success in pharmacy business for large shop or pharmacies with the largest inventory or being in the best location. Well, while all of these are important factors, however, we see that they are not actually what predicts sustainable growth. So what we've noticed over the years is that pharmacies that continue to grow consistently and repay their credit facilities with us have about 4 things in common. And the first is that they know their numbers. So in this case, if you meet a pharmacy owner now, he should be able to tell you off the top of his head what his monthly sales is, what his gross margin is. He should be able to tell you what products are the fast-moving products, the slow-moving products. You know, all of this information is what now helps those pharmacy businesses to make more informed decisions based on facts rather than making decisions based on mere assumptions. Right. Another trait that we've seen in pharmacies that continue to scale and continue to be in successful business is the fact that they they separate their personal income or personal cash flow from business cash flow. So these pharmacies, they understand that revenue is different from profit. So in essence, we've seen cases where a lot of pharmacies make common mistake of treating their business account like personal wallet. So what they do is after every week of good sales, they feel like, oh, we've sold so much this week, and the next thing they do is to withdraw from the business account, not realizing that they are actually meant to withdraw from the profit. They have actually withdrawn from the revenue, which is what they are actually meant to use to restock, right? Actually meant to use to pay suppliers, meant to use to repay their credit facilities. So along the line, pharmacies that that actually exhibit this kind of habits struggle along the line. They struggle with stock out. They struggle with not being able to meet up payment to suppliers, not being able to meet up payment to their bankers, and at the end of the day, such pharmacies struggle. So this indication is just what differentiates successful pharmacies from the ones that struggle. And another one is pharmacies that continue to grow, they build trust. So building trust has to do with first building trust with your patients, that is the customers. Because customers come to your pharmacy not because you have the biggest shelf, you have the biggest inventory, but because they trust you as a pharmacy. They trust that when they come, you don't sell adulterated products to them. You sell authentic products. So this trust is what leads to repeated businesses. And also trust with suppliers. I mean, when your suppliers gives you product on credit, for example, you pay back on time as and when due. This is when they're able to give you more credit supplies in form of spontaneous financing, which now leads to working capital that you use in running your business. Also, trust with your bankers, especially your lenders. When you continue to repay your facilities as and when due, that is where rival will know that, okay, this person pays regularly, and then we continue to fund your business and fund your operation, and that's how sustainable businesses are built. And finally, we realize that businesses that continue to scale are those that use finance, they use the finance diligently. So this is what I mean. They do not just borrow money because they are short of cash. They approach the bank for finance because they've seen opportunities to generate more cash than the cost of that finance.
We know